Ever experienced a nagging pain behind your eyes? This is a common symptom of certain types of headaches. Picture this. You're sitting at your desk, staring at your computer screen, and suddenly you feel a dull, throbbing pain starting to build up behind your eyes, or perhaps it's more of a sharp stabbing sensation that takes your breath away. Regardless of how it manifests, this discomfort is a common symptom of certain types of headaches. Headaches behind the eyes can range from mildly irritating to downright debilitating, and understanding what's causing your discomfort is the first step to finding relief. The type of headache you're experiencing determines the cause. It's like a jigsaw puzzle, and each piece connects to form a complete picture of your pain. Ranging from tension-type headaches, which are often caused by stress or digital eye strain, to more severe forms like migraines, headaches behind the eyes can affect anyone at any time. They're a universal discomfort, a common language of pain that many of us speak all too fluently. But how common are these types of headaches, you may ask? Tension-type headaches, the most common form of this discomfort, are something most of us have experienced at some point. Whether it's due to a stressful day at work, a lack of sleep, or even certain foods, these headaches can sneak up on us when we least expect it. Then there are the more severe forms like migraines that can cause severe recurring pain behind the eyes. These aren't as common as tension-type headaches, but they're still a significant issue for many people around the world. Understanding the type of headache you're dealing with is crucial to finding the right treatment. So remember, the next time you feel that familiar twinge of pain behind your eyes, take a moment to consider what type of headache it could be. It's the first step towards finding relief and getting back to your day. And on that note, let's delve deeper into the common culprits behind these headaches in our next scene. Stay tuned. Tension-type headaches, often resulting from stress or digital eye strain, are the most common culprits behind eye pain. Now, let's delve deeper into these tension-type headaches. When we talk about tension-type headaches, we are referring to the most common type of headache that people experience. They are the usual suspects when you feel that familiar, dull ache around your head or behind your eyes. These headaches are often the result of muscle contractions in the head and neck region, and they can be triggered by various factors. One such factor is stress. It's no secret that stress is a common part of our lives, and it can manifest physically in the form of these headaches. Stress can cause the muscles around your neck and scalp to tense up, resulting in a tension-type headache. Another common trigger is digital eye strain. In our tech-dominated era, many of us spend hours each day staring at screens, be it for work or leisure. This prolonged exposure can strain our eyes, leading to discomfort and, you guessed it, tension-type headaches. So, how can you tell if you're experiencing a tension-type headache? Well, these headaches typically cause a constant pressure or ache around the head, especially at the temples or back of the head and neck. Some people describe it as feeling like a tight band around their forehead or at the back of their head, but don't fret. There are several treatment options available. Over-the-counter pain relievers such as aspirin, ibuprofen and acetaminophen can provide relief. Non-drug treatments like relaxation techniques and stress management can also be highly beneficial. It's important to remember that each person is unique, so what works for one person might not work for another. Always consult with a healthcare professional before starting any new treatment regimen. Tension-type headaches can be bothersome, but with the right approach, they can be managed effectively. Remember, understanding your headaches is the first step towards finding relief. Moving on to migraines, these severe recurring headaches can also cause pain behind the eyes. Now, migraines are not your regular headaches. They are a neurological condition characterized by intense, debilitating headaches, often accompanied by nausea, vomiting, and extreme sensitivity to light and sound. The pain caused by migraines can last for hours to days, and the severity of the pain can be so intense that it hampers your daily activities. The exact cause of migraines is unknown, but they're thought to be the result of abnormal brain activity, temporarily affecting nerve signals, chemicals, and blood vessels in the brain. Certain factors may trigger migraines, such as hormonal changes, certain foods and drinks, stress, and changes in wake-sleep pattern. The symptoms of migraines often begin with a dull ache that gradually intensifies into a pulsating pain. This pain can be felt on one side of the head or both, and in some cases it can cause a throbbing pain behind the eyes. Some people may also experience an aura before the onset of the migraine. Auras are usually visual disturbances such as flashes of light or blind spots, but can also include other disturbances, such as tingling on one side of the face or in an arm or leg. When it comes to treating migraines, the goal is to prevent attacks and alleviate symptoms when they occur. Over-the-counter medications can provide relief for mild to moderate migraines, but severe migraines often require prescription medications. Non-medication treatments, including relaxation techniques, can also be beneficial. It's important to identify and avoid your personal triggers to prevent migraines. Migraines can be debilitating, but understanding them is the first step towards managing them. Sinus infections, though not immediately apparent, can lead to inflammation and pain behind the eyes. You might be wondering, what's the connection between my sinus and my eyes? Well, let's delve into the fascinating world of human biology. The sinuses are hollow spaces in the bones around the nose that connect to the nasal passages. When these become inflamed or infected, it can result in a condition known as sinusitis. Now, the interesting part is that the sinuses are located near the eyes, and when they swell, it can cause pressure buildup, leading to a distinct type of headache. Yes, you've guessed it, the kind that causes pain behind the eyes. Sinus infections can be caused by a variety of factors, ranging from common colds to allergies to bacterial, fungal, or viral infections. The symptoms often mirror those of a cold, including nasal congestion, a runny nose, and facial pain or pressure. But here's the catch. These symptoms persist longer than a typical cold, often for more than a week and sometimes even come with a fever. The good news is there are treatments available for sinus infections. Over-the-counter remedies can help with symptom relief, while antibiotics can be used for bacterial infections. In some cases, your doctor might recommend a nasal spray or even a procedure to drain the sinuses. But remember, prevention is always better than cure. Keeping your sinuses healthy by staying hydrated, avoiding smoking, and maintaining good hygiene can help reduce the risk of sinus infections. Sinus infections can be tricky to diagnose, but once identified, they can be treated to alleviate eye pain. And with that, we've uncovered another hidden cause of that pesky pain behind the eyes. Stay tuned as we dive deeper into the world of headaches in the next scene. Cluster headaches and paroxysmal hemicrania, though rare, can cause intense pain behind the eyes. These types of headaches are not your typical throbbing migraines. They are a different beast altogether, known for their extreme severity and distinct characteristics. Let's delve into cluster headaches first. They are called cluster because the attacks come in groups. Imagine having a piercing pain in one eye and around that eye several times a day for weeks or even months, and then it disappears, only to return the same time next year. That's the pattern of a cluster headache. It's been described as having a hot poker shoved into your eye, and the pain is so intense that it's often considered one of the most painful conditions a person can experience. Now, onto paroxysmal hemicrania. This type of headache is characterized by severe throbbing pain that occurs on one side of the face, often around the eye. The attacks are shorter, usually lasting between 2 to 30 minutes, but they can occur up to 40 times a day. The pain is often accompanied by symptoms like tearing, redness of the eye, and a drooping eyelid. So what triggers these headaches? It's unclear, but some factors like alcohol, smoking, certain foods, or even a change in weather can set them off. And while these headaches are rare, they're more common in people with a family history of cluster headaches or migraines. Now let's talk about treatment. For cluster headaches, oxygen therapy and triptan medications have been found to be effective. Preventive medications like verapamil and lithium can also be used. Paroxysmal hemicrania, on the other hand, responds well to a medication called indomethacin. These rare headaches can be intensely painful, but with the right treatment, they can be managed. It's important to consult with a healthcare provider to get a proper diagnosis and treatment plan. Remember, you don't have to live with the pain. There are options available to help you manage and even prevent these debilitating headaches. Finally, we have stabbing headaches, also known as ice pick headaches, which cause brief but intense stabbing pain around the eye. These headaches, as you might guess from the name, are characterized by sudden, sharp and severe pain that can make you feel as though you've been struck by an ice pick. Unlike other types of headaches we've discussed, stabbing headaches are often very brief, lasting only a few seconds to a minute at most. Now, you may be wondering what causes this sudden and intense pain. The exact cause is still a mystery to medical professionals, but it is thought that certain factors such as stress, fatigue, or even changes in weather could potentially trigger an episode. In some cases, stabbing headaches can occur spontaneously, without any apparent trigger at all. The symptoms of stabbing headaches are quite distinct. The pain is usually localized to one area, often around the eye or temple, and is described as a sharp stabbing sensation. This pain can occur several times a day, and while brief, it can be extremely intense. In fact, the severity of the pain is often what prompts individuals to seek medical attention. As for treatment options, over-the-counter pain medications can sometimes help. However, due to the brief nature of these headaches, it can be challenging to take medication in time to alleviate the pain. In some instances, preventive medications such as indomethacin can be prescribed by a healthcare provider. These medications are taken regularly to reduce the frequency and severity of the headaches. In addition to medication, relaxation techniques such as deep breathing, meditation, and yoga can also be beneficial. These methods can help reduce stress and tension, which may in turn decrease the frequency of stabbing headaches. Stabbing headaches can be alarming, but understanding them can help you manage them better. Remember, if you are experiencing any type of severe or recurring eye pain, it's always best to consult with a healthcare provider to rule out any serious underlying conditions. Now that we've discussed the different types of headaches that can cause pain behind the eyes, let's answer some common questions. Firstly, what triggers these types of headaches? The triggers vary widely, but some common ones include stress, lack of sleep, and certain foods. For instance, if you find yourself frequently squinting at a computer screen or under a lot of stress, you might experience a tension-type headache. Likewise, if you've been skipping meals or not getting enough sleep, you could be setting yourself up for a migraine. Next, how can I prevent headaches behind the eyes? One key preventive measure is identifying your personal triggers. If you know that stress or certain foods set off your headaches, managing these factors can be a big help. Also, maintaining a healthy lifestyle, eating a balanced diet, getting enough sleep, and exercising regularly can go a long way in preventing these types of headaches. Another question often asked is, when should I seek medical attention? Most headaches behind the eyes can be treated at home with rest, hydration, and over-the-counter pain relievers. However, if your headache is accompanied by severe symptoms such as vision changes, extreme sensitivity to light or sound, or nausea and vomiting, it's time to consult a healthcare professional. Also, if the frequency or severity of your headaches increases, or if the pain becomes unbearable, don't hesitate to seek medical help. Some of you have also asked, what are some non-medication treatments? There are several options, including relaxation techniques like deep breathing, yoga, or progressive muscle relaxation. Biofeedback, a technique that teaches you to control certain bodily functions, can also be effective. And of course, regular exercise and a healthy diet can contribute to overall well-being and potentially reduce headache frequency. Lastly, can these headaches cause permanent damage? The good news is, most headaches behind the eyes don't cause lasting harm. They can be intensely painful and disruptive, but they're not typically associated with any long-term damage to the eyes or brain. However, any headache that feels different or more severe than usual should be evaluated by a healthcare provider. Understanding headaches and their connection to eye pain can help you manage your symptoms and seek the right treatment. Remember, when in doubt, always consult a healthcare professional.